Can an acute viral infection cause chronic fatigue syndrome? Imagine recovering from a flu or a bout of chickenpox and still feeling exhausted months later. That lingering fatigue can be confusing and frustrating. Scientific research shows that an acute viral infection can indeed trigger what is known as chronic fatigue syndrome or myalgic encephalomyelitis. Many cases of this complex condition start after a person has had a significant viral illness. Studies suggest that around 3/4 of ME or CFS cases follow an infection that the person doesn't fully recover from. Common viral triggers include Epstein-Barr virus, which causes glandular fever, varicella-zoster virus responsible for chickenpox, influenza viruses, and enteroviruses. While non-viral infections can sometimes act as triggers, viruses are the most frequently linked pathogens in these cases. The connection between a viral infection and the development of ME or CFS involves several biological processes. Some viruses have the ability to evade the immune system and change how immune cells function. This can lead to prolonged immune activation and ongoing inflammation. When the immune system stays activated for a long time, it releases signaling molecules called cytokines. These cytokines can cross into the brain and affect how it functions, leading to symptoms like extreme fatigue, muscle pain, and difficulty concentrating. Elevated cytokine levels are often found in people with post-viral fatigue, supporting this idea. Further evidence comes from studies showing that some viruses can persist in tissues long after the initial infection. For example, enteroviruses have been detected in stomach biopsies years after the person first got sick. This suggests that in some cases, the virus isn't completely cleared, which might contribute to ongoing symptoms. Additionally, research has identified mitochondrial dysfunction in ME or CFS patients. Mitochondria are the energy-producing parts of cells, and when they don't work properly, it can lead to fatigue and low energy levels. Viral effects on cellular energy metabolism could be a reason why some people experience long-lasting symptoms after an infection. Epidemiological data also support the link between infections and ME or CFS. Large population studies have shown that people who experience certain infections have a higher risk of developing chronic fatigue later on. For example, individuals infected with specific viruses or bacteria are more likely to be diagnosed with ME or CFS compared to those who haven't had these infections. It's important to note that not everyone who gets sick with a virus will develop chronic fatigue. Some people recover fully, while others may have a gradual onset of symptoms without a clear infectious trigger. Factors like stress, immune system health, and other personal health issues can influence whether someone develops ME or CFS after an infection. In summary, acute viral infections can act as a trigger for chronic fatigue syndrome by causing long-term immune system changes, persistent inflammation, and sometimes ongoing viral presence in the body. These processes can lead to the complex symptoms seen in ME or CFS, including fatigue, cognitive issues, and muscle pain. Since this is a complex condition with many factors involved, anyone experiencing persistent fatigue after an infection should consult healthcare professionals experienced in diagnosing and managing ME or CFS. Ongoing research continues to explore these mechanisms to improve understanding, diagnosis, and treatment options for those affected.